Hi, everyone. Good evening and a warm welcome to all of you on behalf of Parama Naturals. For this inaugural session of ParamaTalks, which we have aimed to be a series of conversations with experts who can help us navigate our paths into self-care and wellness, areas which were always so important to us from time immemorial, but often neglected but have now, due to unfortunate circumstances, but good for all of us today, at least they have come back into our mainstream. Today, I have the pleasure of introducing to you Dr. Jyoti Gulati. Dr. Jyoti Gulati is a general physician and an MD in general medicine from the BJ Medical College in Pune. She has been the co-founder of several hospitals and has had 3 decades of experience, very rich experience as CC in charge, as having been very, very involved with lifestyle medicine and lifestyle diseases, and also geriatric care. And today, after this last little over a year of experience with COVID, she's dealt with so many patients across different hospitals and in her personal practice. And for several of you who are interested, she is very, very passionate about diabetes, about cardiac diseases and geriatric care, as I mentioned. And behind all the seriousness, there's a fun person who lurks behind, is very passionate about music, traveling, and poetry. But more about that later. Today, she's going to help us understand so much more about what has been the impact of COVID on women, and which was one of the worst set of people which were affected last year. So many of you did ask for some questions in advance, which we raised it up to her. And she would be covering all those points in her talk as well. And subsequently, we will have a Q&A session. And just as a hygiene factor, I would like to mention to all of you to request you to mute your mics, though we have taken charge of that for the time being. And we also need to mention that we will be recording the sessions. But over to you, Jyoti, and we will, any of you who do have any specific mentions, please put them in the chat. We would not like to disturb the flow initially. So if I can request all of you to send in your questions or any apprehensions or clarifications in the chat box. So over to you, Jyoti.
Friends, it's, the topic today is concerning mainly women. I would start my talk with a saying which is very close to my heart. Taking joy in living is a woman's best cosmetic. I always believe that every woman enjoys every part of the life that she lives, whether she's a professional, whether she's a mother, whether she's a wife, whether she's a newly wed, she's a daughter-in-law, she makes the most of every situation and rises above it and shows her best in everything. So the year 2020-21 has been the year of the pandemic. This pandemic was a disease which hit us by surprise. Very little was known to the doctor fraternity about it. And it hit us from the wild and took us by storm and led us to all be at home and work from home. And we all got locked down. We got locked in the houses during the lockdown. And then it resulted in various emotional and physical issues, which as doctors, can I just not have this on my screen? Yeah. So I would like to first touch upon what the pandemic has caused a certain health issues among patients, and then tell you about how COVID has affected post-COVID health problems which patients are facing. So this pandemic, as I told you, brought in the situation where most of the people were locked inside the house as there was a lockdown outside. Well, except for the doctor fraternity, I think everybody was working from home, and work from home had become the new normal. And we faced, as doctors, faced a couple of issues which we saw among our patients. There were certain physical problems which were on the increase, like there were people complaining of constipation, piles, and irritable bowel like syndrome because of continuous sitting long hours on front of the computer, working from home, lack of exercise, lack of opportunities to go out. Then what we saw in a huge number was backache, neck pain, because again, long hours of sitting and working in front of the computer, or the housewives were strained doing the housework. There were no maids to help them. Then another complaint which we saw very often was eye strain and eye pain. Again, could be related to the use of computers or the other gadgets which everybody has at home these days. Then the another common complaint we experienced was ear pain, which I feel could be, a lot of use of the ear pods for using the various gadgets. Then a massive increase in the obesity, what we saw, because people were binging on new dishes which they were cooking. The family was cooking for each other, and there was lack of exercise. So the obesity was on a rise. People were complaining of weight gain. And because of weight gain, there were complaints of lethargy, aches and pains in the body, unable to do the best, unable to perform. Another thing very commonly seen were various kinds of allergies. And when the COVID just set in, there were allergies to the various kinds of sanitizers which are available. People were overusing the sanitizers, and we used to get so many patients with skin allergies due to sanitizers. Then I was talking to a couple of my friends before the talk, and an oncologist friend of mine told me that there were many patients who came very late for their detection of cancer. They sat over with their lumps in the breast or the other symptoms just for the fear of approaching the doctor in COVID times. Now, emotionally, what we saw was initially the fear of COVID. Like everybody was scared. How does this disease spread? Should I touch anything? Should I not meet anyone? So there were huge barriers. Nobody would talk to anybody. There were things brought from outside were sterilized, clean. The lifts were not touched. The buttons could not be touched. There was a huge scare. That fear brought in a lot of emotional problems. People used to do their COVID tests at the drop of a hat if they would have a cold, cough, and multiple testing would go on. This led to a lot of issues like anxiety, depression, palpitations, exacerbation of the OCDs. Well, to tell you in brief, the maximum number of online consults which I have done during this pandemic were young people or people of all age group complaining of lack of sleep, unable to sleep, anxiety, and depression. So that's how this pandemic has affected us. Now, socially, also we saw some things like there were increased pregnancies. I mean, the wanted pregnancies, for what reason. There were professional fallouts, and there were also intimate partner violences noticed. So in this aspect, what we saw was there was another slide in between. So looking at the social things which went on during this time, what we saw was, I mean, when you talk about professional fallout, it was also because there was lack of opportunities of work. People were dropping down, they were leaving their jobs. Women would not take up the promotions because of so many responsibilities at home. And then when people were people were staying together, there were chances of increased over interactions leading to partner violences. And there has been data from all over the world, especially from Russia, which showed that there was an increased violence in the families because of staying indoors for a long time. It normally doesn't get reported in India because it is treated as a common norm very often. Now, the ups and the downs, if we saw the downs, there were ups in the pandemic time where people had more family time. There was more bonding with each other. People could concentrate on their hobbies. They wasted less time in traveling. Cooking and doing a lot of things together was very well seen. The most important thing, which I think all of us realized, was the importance of small, small things. How important it was to have the maid come in time for doing the work, or how important was to have your fridge filled up with all the ingredients you wanted. And there were times, when you couldn't get a lime, or you couldn't get a particular ingredient to make a dish, and you learned how to substitute it. So, I mean, the pandemic has taught us a lot of this. And these were the common medical issues which, as doctors, I faced and treated them early, and they all did better. So, now going to what issues I faced. Someone can you give me a little bit of time? Now, what post-COVID issues? So many, all of us, I think all of you that I'm talking to must have had a COVID patient either in the family, near and dear one, or a friend or a neighbor. So you have seen COVID from close quarters. And once the patient recovers from COVID, there are many symptoms which persist for a couple of weeks to months. So I just want you to be aware of them so that one doesn't get alarmed about it. So these are the different organs. So what I'll tell you is generally what we see the post-COVID times, the patient continues to have fever on and off for a couple of weeks. People complain of fatigue for a couple of weeks. Loss of smell and taste can persist for a couple of weeks. Joint pains, muscle pains, weakness can last for months. So these are common things which can just be treated with good diet, exercise, and multivitamins. And in the respiratory system, we often see people complaining of cough for over a month after recovery, breathlessness, recurrent episodes of upper respiratory tract infection, sinusitis. Dermatologically, we have seen patients coming with various types of rashes, allergies, complaining of severe hair fall, and exacerbation of the dermatitis which they had earlier. From the cardiac point of view, patients who never had blood pressure landing up with high BP. There are various kinds of chest pain. There is ischemic heart disease, increased risk of heart attacks, pulmonary embolism, myocarditis. All of you need to be aware of it. So if a patient post-COVID does complain of chest pain, we don't have to take it lightly, get it tested. It may be just a part of the COVID recovery, or it could be something, the heart or the lungs getting affected a little later post-COVID. In the endocrine organs, post-COVID, during the COVID time, many people have increased blood sugars, which persist even after recovery. The sugars fluctuate a lot during the COVID and remain high even post-COVID for a couple of months. The thyroid hormones fluctuate a lot, and they may be low or high, and then we need to treat them accordingly. In the abdominal part, we see a lot of patients complaining of constipation, nausea, abdominal pain, persistent few weeks after recovery from COVID. IBS persists couple of weeks after recovery. Neurologically, we see patients having huge amount of migraine. I think this is the commonest reason for which patient consult us. One is ongoing fever, ongoing weakness, ongoing cough, and ongoing headache, the four common symptoms post-COVID. So headache, dizziness, a little bit of cognitive blunting can remain for a month or maybe a couple of months till post-COVID. Now, the gynecological problems which we have seen post-COVID are irregular menstruation, difficulty in conceiving. Well, those women who got infected in the second wave had a little bit more severe COVID, landed up in the ICUs, required oxygen. They landed up with miscarriages, preterm births, and preeclampsia. Preeclampsia is hypertension and pedal and passing protein in the urine in pregnancy. Then the emotional aspect, which was, I think, the second most common after fatigue, cough, and headache. These are the symptoms which most of the patients have been coming to us post-COVID, complaining of mood swings, depression, lack of sleep, insomnia, anxiety, and the worsening of OCD. So the social impact I already discussed with you. What was happening during the COVID and post-COVID is there is an increase in intimate partner violence. Well, this associates more with the lockdown period and not with the post-COVID illness. So my takeaway message for you all is that COVID is a viral infection. It's basically the inflammatory response of the viral infection which gives us the main symptoms like the breathing problem or the requirement of oxygen or the sugars shooting up, or there is other organ affection, which is because of the inflammatory response. So early treatment is the key to the success or to you go to your doctor early in the first 2 to 3 days, start the treatment in time, and don't go and rush for the tests. Do the tests as suggested by your doctors. Don't go for a CT scan. The CT scan should be done on the 5th or the 6th day of the illness. The earliest tests are just the COVID test, the hemogram, and a CRP, and these could be repeated at regular intervals. The third thing which every person should remember from this COVID pandemic and this particular year, is always keep your BP, sugar, and other parameters in check. Fourth is obesity. In this pandemic, we have realized that all obese people have had a very major illness as compared to their thin counterparts. So avoid the obesity, take care of your diet, improve your immunity by using whatever you believe in, whether it's the herbs or the kadhas, but please don't overdo it. Do it in limits, but improve your immunity by eating good food, healthy food, avoid junk food, exercise regularly. And in the long run, I feel, when I look at all successful people, I feel the mantra of early to bed, early to rise is what keeps you going and keeps you healthy, wealthy, and wise. Well, many of the youngsters may not agree with me, but I'm telling you, this goes a long way. So whenever my patients of depression or anxiety, and I talk to them and I tell them to just follow this, that go to bed at a particular fixed time, and next day channelize your energies and make a fixed routine. And this is the time for your walk. This is the time for your for your eating. This is the time for your siesta. This is the time for work. When you follow a clockwise pattern, it helps you and your depression to get better faster. So these are my key home takeaway messages for you all. So ladies, a strong woman loves, forgives, walks away, lets go, tries again, and perseveres, no matter what life throws at her. So stay happy, keep your immunity up, exercise, eat healthy, and keep on doing the good work that you're doing. Thank you very much.
Thanks, Jyoti, for that amazing overview on all the problems that women had, and probably it extended, of course, beyond women too. And it's quite a shocker about all the kinds of problems that people had. I guess in our layman lives, we were exposed to only a small fraction of what, let's say, our friends or family were going through. But the whole spectrum puts this whole COVID virus, even though you've said it's just a viral infection, but it really was something quite deadly because of the manifestations that it has had, and the duration for which these after effects last. So I loved your mantra about, sleep early, eat early, because ultimately it's all about getting our life back in order. I think, I guess we also took ourselves for granted. We took everything in life around us for granted, and this has really shaken the core roots of our foundation. The impact is quite shocking but very revealing. And I think some of the things that you've talked about of how to take care of ourselves, I think that is extremely important. So now I think it's we should look at taking some questions from the panelists, from the participants. And one which was messaged a little earlier was while you have kind of, touched upon it, but since COVID is here to last, and definitely there is a lot of talk about the third wave. There are questions about vaccinations. Should we not? What are the things that we should look at doing to protect ourselves in anticipation of a third wave? Is there something that you can share on a little more detailed space, or a little more detailed?
The third wave is very much in our hands. If we go overboard and start getting together in crowds and start visiting shops again, the third wave will come. But if we avoid it by doing all these things and get yourself vaccinated. Please don't wait for one X particular vaccine. Whichever vaccine is available, all are having the efficacy above 70 to 75%. Please take the nearest vaccine available. So the only way of getting across with this virus is if there's herd immunity, if the maximum people are vaccinated, the virus does not mutate. The virus gets killed slowly, and then we will be able to overcome this virus. So vaccination and keeping the COVID protocols on will prevent the third wave.
There was one very specific question where they had talked about menstruation cycle getting disturbed. You did talk about it, that it is a prevalent thing, but we've had both the situations where somebody had very, very severe early onset within 15 days. And there was somebody we've had a question where somebody's had it, more than 45 days. So are there different kinds of precautions that women need to take during this phase?
See, the stress is the main factor which affects the menstruation. So because of the stress, working from home, and women have been multitasking. I had a patient recently who said that her workload had gone fourfold during the lockdown, because the husband works in one room, the children study in the other room, and she just has the two children use the two bedrooms, and she's probably in the kitchen, and then every 2 hours she has to give snacks to everybody. So like when the women are more stressed, the menstruation gets disturbed. The only thing is, if it has happened just once, one can ignore it. It could be because of the hormonal changes or the environmental changes. But if it has happened twice or thrice, better to consult your gynec. Always remember, the menstruations, high menstrual bleeding or irregular menses are commonly related with low hemoglobin, thyroid abnormalities, or a fibroid. So look out for these three things. Doctors were working all the time. People were hesitant to go to doctors during the COVID time, and they lived with their illnesses many a time. So you can always do a web talk with your doctor. Get these three parameters checked. If your thyroid, hemoglobin, and sonography is all right, it's more of an emotional issue, and it settles down with time. I can see a few.
There was another, yes. So there was another question where they talked about the very high sugar level, and the person was not on medication prior. During the period of COVID, they had to start taking the metformin. So one of the questions was, does she need to consult a diabetologist now to see how to take it forward? Or what should she stop the medication after about 3 months, or should she, is this likely to stay on like gestational diabetes?
See, now what we have seen is that those who were pre-diabetics, or they turned out to have diabetes with COVID, because with COVID we are giving steroids, and COVID by itself is an inflammatory response of the body. So there is more sugar in the body, and the insulin is partly deficient. So transient diabetes in the pre-diabetics, or those who had gestational diabetes earlier, or those who are obese, is known. But maximum of the time we are seeing in the next 3 to 4 months, the sugars are coming down. But there are 10% of the people who have become diabetic, and they will require medication. So please, for the next 4 months after recovery, keep checking your sugars. If they remain normal, that means you are out of it. I mean, there's no diabetes. If it is high, with 1 or 2 tablets, you will settle down.
Archana has asked a question. She's had both vaccinations, and is it right to have the antibodies test?
See, now there is a problem there with the antibody testing. The various kinds of kits which are available don't test the exact titer of the antibody, and the antibody titers don't correlate with your immunity. So this discussion happens in our medical meetings at least 3 to 4 times a week. And we are not advocating the use of antibody testing for just normal people. But there are certain group of people, like those who have had cancer and they are on certain chemotherapy medicines, or those who are on immunosuppressive medicines for various other diseases. They need to take booster shots to improve their immunity. In those people, there are these, there are neutralizing antibodies, there are spike protein antibodies, there are multiple type of antibodies. Those are the only people who should get it tested from two labs. And then if the antibody titer is significantly low, they need to go for a booster dose, the transplant patients, because they are also on immunosuppressant. But for normal public, as of now, there is no foolproof test which tells you your antibody titer and which tells you whether you need to revaccinate or something. So don't believe in the tests right now. As of now, the Indian as well as the guidelines from abroad say that if you're vaccinated twice, 15 days after the second vaccine, your antibody titer is good enough, and pray to God that it stays that way. Now, whether we need a revaccination, our medical fraternity, the Pune task force for COVID, our masters in this team say that we will all require booster shots every year, but time will only tell us. But that's the prediction right now, that every year we need a booster. But as what the predictions are from the medical fraternity, by January, this will become just another disease like cough, cold. There will be no segregation of patients, and we will all move on and live with COVID.
I guess life has to come back to normalcy sometime. There's another question from Anvita, who's asked whether these most of these symptoms, are they common to men as well, like chest pain and stiffness and irritable bowel syndrome, etc., or are they focused on women?
Well, during the COVID time, you will be happy to know that men are affected more, and men are affected more severely than women, as far as all the statistics go. But the post-COVID symptoms we are seeing more in women because of I think the women are far more sensitive than men. So the PCODs, the depressions are maximum I have seen in the women. And even the IBS, yes, it is common in both. Yeah. I mean, lots of patients have come back with abdominal pains, nausea, not able to eat for even 1 or 2 months post-COVID. I think, the intestine also gets affected with the COVID infection. So that also takes its time to come back. So just with probiotics and a change in the diet, all of them do okay.
There have been several questions on, after a person has been infected by COVID, how many rounds of vaccination should they take? 1 or 2?
See, the first 3 months, you should not take the vaccine. These are the Pune task guidelines and the ICMR guidelines released in the end of May. What they say is when you have an infection, you're protected with the antibodies. Don't waste those antibodies. So take the first vaccine after 3 months so that it boosts up the antibodies, and then your second vaccine as per the time schedule. But 3 months, wait, because only in the patients who are post-transplant or cancer patients do your antibody titer. Because again, post-COVID, there is no reliability. How much will your antibody titer be? There are patients with mild infection who have a very good antibody titer, and there are patients with severe infection whose antibody titer doesn't show well. But again, I told you, the antibody titer is not the measure of your immunity. So by and large, 3 months, you are immune to the disease. Don't take the vaccine. Take it after 3 months. Use this immunity. Otherwise, what happens is when you take the first vaccine, the antibodies from the infection and from the vaccine together give you a very severe infection, give you a severe reaction. So rather than that, enjoy the antibodies which you have got from the disease for 3 months. And now the task force says the first vaccine after 3 months, except in those who are transplant patients or those who are on immunosuppression or those who are severely ill category, where we advise them to take it earlier in 4 to 6 weeks. And the second repeat vaccine is as per the schedule, whether you're taking Covaxin, it's 28 days. If you're taking Covishield, it's 90 days, I think now.
There seems to be one good story here by Manimala. She said she used to be on BP medicine earlier, but post-COVID, her BP is low or normal and medicines were stopped. So she hasn't yet started the, yes, is it possible?
It's good. There are people who have stopped, and there are people who've gone on to BP medicine. So you're one of the lucky ones. Probably another thing is that she's my very close friend and a good patient of mine for years together, ever since I started my practice. I'm sure, Manimala, you must have lost weight. That also helps you to control your BP.
Okay, they're actually all on mute because we're on webinar mode. So we'll probably open the questions She says she hasn't lost weight.
Then
I wish I did.
you're not stressed. That means that's the main thing.
Now, I know her personally, so I know in her case, actually almost everybody in her family and immediate family had fairly severe cases of COVID infection. There are several questions which are around immunity building. And of course, before immunity building, we'll come to somebody had a question about probiotics. And what is the probiotic that you recommend for people to use? She talked about Yakult, but are there any other probiotics that they can have?
I mean, I can't name the brands. All the brands have similar effect. But time tested, we are using Econom and Vibact for years together. Still, don't use it, off the counter. If you have a digestion issue which is prolonged and not settling with curd and your Yakult and the home remedies, you can take probiotics are safe. You can use them for 10-15 days, not an issue at all. Standard names, see, I don't want to promote any company, but Econom and what did I tell you? Vibact and Besalac we are using for maybe 15-20 years and with good results.
So coming back to the elephant in the room, which is immunity building, how do you recommend that, apart from the good sleep and good food, but what are the very specific things if we have to dovetail into our diet, into our daily living and lifestyle? Are there some very specific things that, yes, these things definitely help to boost immunity and you should do lots of? These things definitely help to reduce the immunity and so you should definitely reduce. Are there some mantras that we can use going forward?
See, now from the medical aspect, what I can tell you is, just popping in pills is not, now there are side effects of zinc. Also, people were taking zinc off the counter for months together. Zinc has been proposed to be one of the reasons for mucormycosis. So overdose of any vitamin is not good. What I feel with personal experience and experience of my patients, one thing is follow a good fixed routine that helps you in the long run. Early to bed, early to rise is what I feel has helped me always and, come out of major illnesses also. And build up if you're eating good healthy food, avoiding the junk food majority of the time with your fruits, vegetables. I don't say add organic food or organic vegetables, just good, well cooked, well washed vegetables. Out are the days where we were sanitizing the bhajis, we were getting, because there is no transmission by surface. That's what the conclusions are. The transmission is from aerosols and from the sneezing and the coughing. So your source of infection is from your eyes, ears, nose, and mouth. So there's no infection which is going through the food or by touching surfaces, or no infections have been proven by that, and neither by by touching the parcels and all that. So it's this you have to build up this aspect. So when you're exposed, keep your masks on. The minimum time of exposure to a patient should not be more than, patient means anybody suspected as a patient, should not be more than 12 to 15 minutes. That is one thing. Secondly, I'm not used to any Ayurvedic things, like a lot of people and a lot of my patients take various types of giloy, kadas. I don't know. I have nothing against it. Whatever suits you, but we've had problems, severe acidity with too much of kara. So take it once a day, not 3-4 times a day, or maybe twice. The only thing I recommend, I've seen my mother do it religiously last 1.5 years, is steaming gargles once a day. Enough. Don't do it 4-5 times a day. So that's good. That's time tested, scientifically proven. Keep your upper respiratory tract healthy so that the virus doesn't go in. The virus goes in and goes inside the mucous membrane. So even if it goes in, let it go out with all these things. So I just feel good food, healthy food, home cooked food, fruits, vegetables, little bit of nuts and milk, and you do your exercise. Exercise is what we all have learned in this time, that those we have seen patients who were not exercising have had a bad time. Young people going on the ventilators. never exercise because zarurat hi nahi padi. I'm so active. I walk in my office 5 kilometers. That's not enough. You're walking, with stress. That's exercise, prevent obesity. Those who were badly controlled diabetics, those whose heart conditions were not controlled, BPs were high, all landed with complications. Very few normal people who were living a healthy lives, very few. I'm not saying they were not, but those were very few. Only when these things were out of control, the parameters were out of control, and there was no exercise at all, there was too much obesity, the problems were there. So control these. However you control them, it's up to you. And exercise. If nothing else, please do pranayam. I'm telling you, pranayam has helped all our patients in the recovery phase post COVID. All that we tell them is spirometry and deep breathing exercises, and they all do well. It's only 1 or 2% people who are requiring oxygen 3 months down the line because they are old, their lungs were already weak, or because of low immunity they had a severe infection. But 99% people have recovered.
There is one complex, I mean, since it's an intriguing case, she said she had her first dose on 1st April, got infected on 23rd April, out of quarantine on 8th of May, no symptoms. When does she take her second dose?
After 3 months.
After 3 months of coming of COVID. Okay. Neha has asked a specific question. She said we are hearing about a lot of deaths due to cardiac arrest, and especially in the age group of 30 to 50. But are there reports that suggest that they could have been asymptomatic COVID carriers who never got themselves tested, but the virus would have had a role to play here? Do you recommend any tests as a routine to keep a check, especially related to the heart?
No, not. I mean, depending upon the age, for young people, we don't recommend routine tests post-COVID. But when the COVID is there, we routinely do all the blood tests and ECG for every patient. If the ECG is normal, we don't expect that the patient should have a cardiac problem. But those who are little elderly, those who have risk factors like BP, diabetes, there's a test called HSCRP. It's the highly sensitive CRP, which is a predictor for cardiac disease. That can be done. Repeat ECGs can be done, and a 2D echo maybe if the symptoms persist, because many of the myocarditis or a beginning of a heart problem can be picked up on a 2D echo.
So I think we have already actually exceeded the time that we had requested from you, Dr. Gulati. If there are any one last question or anything, please message. Otherwise, I think we should. Dr. Jyoti Gulati has already extended her time. And especially in this kind of a busy schedule, we are extremely, extremely grateful that you could take out so much of your time and share with us, because I think the kind of perspectives that you've been able to share, and people are today's, something, one of the biggest pitfalls in modern living, which we have actually come across, people, is that today most people actually lead fairly nomadic lives, and especially professionals. They may have a hometown where they've lived in, but their jobs have taken them to so many different places. They don't necessarily have an ecosystem who they can depend upon. And having a good general practitioner, having a good general medicine doctor whom you can trust upon to answer many of these, even questions that they may feel that they are being silly to ask, is so important for somebody to have that trusted doctor. And I think many of us, our friends in different parts of not just India, but different parts of the world have faced this. So it is wonderful that you've been able to share these experiences and insights to such a wide spectrum of people. And we hope to have more such sessions. So I would, I think the think you've pretty much answered anything. But in any case, if anybody has any more questions that you'd like us to direct to Dr. Gulati, please email to us on paramanaturals@gmail.com. And Dr. Gulati has offered to assist us with that some other time as well. And as a token of appreciation on behalf of Parama Naturals, this is, of course, a virtual gift for you, and it'll be delivered to you with a bunch of course, the Parama Naturals products, because we are very, very passionate about wellness, and we look at even skincare as a means to wellness. So we hope it dovetails in with your wellness passion too. And I think it has been really, really remarkable. I think this evening's session has been so eye-opening, and I have learned so much. So,
Geeta, can I just say 2 words? I just want to take this opportunity to thank the doctor fraternity and salute them for working relentlessly in the last 1.5 years. You know, I've seen my friends, my juniors working in the ICUs day and night, and these small words of courtesy go a long way. All that the doctor needs is the happiness on the patient's face and a good word from their patients. So please go back and say thanks to your doctor, wish your doctor friends, and say thanks to your treating doctors on this day. I've got so many messages, Geeta, today. I think maybe because of the program also, and because when our clinic forwarded the link, I think thousands, maybe 500 to 700. My day is made. All that you need is a wish and somebody saying, "Oh, you saved me at such and such time." Thank you very much, Geeta. It's a pleasure being with you, and I'm sure such things I'm always happy to do with you.
No, definitely. I think a big salute to you, and definitely to all the doctors community. And today is known as Doctors' Day, which was quite an interesting concept. So thanks. I think this whole world wouldn't have really survived without all of you. Thank you so much.
Thanks, Geeta.
And thanks all the participants for a very interactive sessions, for coming today. We had fairly short notices, but many of you have attended. Thank you for coming. And there's a little question. Please just answer. What are the kind of topics that you'd like us to cover in subsequent sessions? Please just leave a note. It's not compulsory for you to leave any IDs or names or anything. And all your data will be confidential with us. So rest assured. Thank you so much for attending and making it really meaningful.